Atrial fibrillation is a bizarre contraction of the top chambers of the heart. It occurs whenever the normal pacemaker is unable to maintain functionality, and when the muscles of the top chamber contract very rapidly as an electrical disturbance, depending upon its cause. Is very rapid contraction of the top chamber at a speed of like 350 times or more. So it is much higher speed than our own natural pacemaker, which beats around 60 to 100 beats. So that's how it starts. So it is an electrical abnormality. Atrial fibrillation can completely remain silent, asymptomatic, diagnosed incidentally when they come for something else. It develops over time, and depending upon the speed with which it happens, that brings the symptoms. Most of the time, if it is too slow, atrial fibrillation, then they can feel dizzy, lightheaded, and they can lose the consciousness. But the commonest way it presents is as a fast atrial fibrillation. So they feel it like a palpitations. Again, because of the fast heartbeat, they can feel dizzy or they can feel breathless, as it can affect the heart's pumping ability. And it can itself cause chest pain, as we discussed in ischemic heart disease area. On it increases the demand for the myocardium. So the even if somebody has got a normal flow in the coronary arteries, that's not enough to support the muscles of the heart, and they get the chest pain. Atrial fibrillation can flare up for varieties of reasons. The commonest and something patients have to be worried is lifestyle, right? Just if you look at a lifestyle like having alcohol, excess intake of caffeinated products, or even smoking, they can also increase the speed. This is just common. Common day-to-day life, anxiety and stress will increase the speed of atrial fibrillation for somebody who already have got it and make us go. The uncommon things which can lead to even hospitalization or conditions like infection, any sort of infection affects our body. At the time, heart rate goes faster, whether we have normal heartbeat or atrial fibrillation, it goes faster. So because atrial fibrillation is an abnormal heart rhythm, at the time they can't control it, and they end up in having a very fast heartbeat, and that causes an additional struggle. So infection can cause it. Any condition that lead to pain will naturally increase the speed of the heartbeat, so the atrial fibrillation rate goes very fast. So medical conditions can aggravate it, right? And we can go and enumerate all the medical conditions. But if somebody is sick for other reasons, that can aggravate it. And similarly, lifestyle can aggravate it. Apart from these two, one of the common condition called a thyroid disease, right? Whenever the thyroid is overactive, it will either bring the atrial fibrillation as a new development or increase the speed of a pre-existing atrial fibrillation at a very faster level. And similarly, the thyroid is underactive, right? It can slow down somebody's heartbeat, whether they have normal heartbeat or atrial fibrillation, and then make them to feel dizzy, lightheaded, or lost consciousness. In those situations, sometimes we need to diagnose the thyroid disease and treat it. The atrial fibrillation is diagnosed with just a simple 12-lead ECG as an incidental finding, or initially just clinical examination. When we examine a patient, we see that the pulse which we feel on patient hand is irregular. So it's erratic. That's the first suspicion. We can confirm it with the ECG. However, on many circumstances, atrial fibrillation may not be there all the time. It comes and goes. It is called paroxysmal. That is a challenge to the medical field. So we can confirm it only by actually investigating the patients bit more thoroughly by using techniques by which either patients can record it themselves at the time of the palpitation, or by giving them a device which records all their heartbeat over a long period of time, and then we can find it out. Atrial fibrillation can be diagnosed even with a smart watches nowadays, very easy for patients who have it, or we can do something called patch test, give a device and they use it for 7 days or 2 weeks and try to record the heartbeats at the time of the palpitations. Or occasionally we do implant small implantable devices called implantable loop recorders that record the heartbeat over a period of up to 2 years. We can monitor and see is there an irregular heart. So many ways we can diagnose and then manage and plan the treatment so that prevent complications. The atrial fibrillation is treated. There are two ways of thinking. One is treating the atrial fibrillation, that is controlling the speed of the heartbeat, which is causing the symptom. If it is slow, you can argue and go and give a pacemaker if there are no other corrections available. If it is fast, you can give medicines to control the speed of this atrial fibrillation and thereby making them to feel better. However, atrial fibrillation is an abnormality with electricity that can lead to more structural abnormalities. So, whenever there are conditions there which can aggravate the progression of the disease and result in complication, we can also consider something called a rhythm control apart from the rate control. Rhythm control is a methodology by which we try to bring the patient back to a regular heart rhythm again so that they can have a good quality of the lifestyle. So we can do a rhythm control with what is called just simple shocks called cardioversion. Some other times we can use medicines to slowly bring them back to a regular heart rhythm. Uh, there are methods called catheter ablations, right, or radio frequency ablations, so that those type of special treatment can help us to bring them back to a regular heart rhythm. Surgically, also, you can bring the patients back to a regular heart rhythm. So there are two modalities. One is a rate control, simple and commonly used for urgent treatment to control the symptoms, and rhythm control for a very specialized group of patients where we try to bring them back to a regular heart rhythm, right? These are the two. Apart from that, sometimes when you go and treat the condition causing it, then you may treat the atrial fibrillation completely. One such condition is overactive thyroid called thyrotoxicosis, where you go and treat the thyroid gland and then the patients will come back to a regular heart. So it is possible sometimes to identify a condition causing it and treat that condition. Yeah, so whenever the atrial fibrillation is very difficult to control with rate control measure, or patients have got conditions like heart failure and atrial fibrillation, where definitely if we go and do a catheter ablation, which is actually passing multiple tubes through the groin artery and the vein up to the usually the heart, the go into the right top chamber, just passing a small hole into the right top chamber to go into the left side. And then they try to map from where this abnormal heart rhythm is coming. It is a difficult process. And then map the areas from where it is coming and then go and burn these areas. Think that it's a microscopic burn. So that what we are doing is a conductible area to become a non-conductible area by making it as a scar so that the electricity won't pass through, so that it can't go down to the bottom chamber to make it as an abnormal heart rhythm. So it is a successful treatment in selected group of patients, and it is commonly used. So, in the atrial fibrillation is caused by multiple things, like patients with the high blood pressure. So we can treat the high blood pressure. A patient with diabetes mellitus will develop it, so we can treat that. A patient who drinks excess alcohol can get it, so they can modify the alcohol intake and reduce it. But the most important thing is atrial fibrillation patients, if they have certain set of risks, they can develop clot formation within the heart. When these clots goes out, it can cause damage to the area it goes. The commonest area, even a smallest clot can travel is the brain. When it goes there, it causes stroke. So it is a direct complication of atrial fibrillation, particularly as the age increases, in particularly after the age of 65. So there are ways we assess the risk through the risk score, and then we try to give them blood thinning treatment called anticoagulants. Traditionally, it was a medicine called warfarin or coumarin derivative, but recently we do have other novel agents which are like warfarin, but it doesn't need regular blood tests or anything to assess thinning of the blood. The idea is to thin the blood, prevent clot, and thereby prevent stroke. In that way, we can avoid this complication, which will debilitate the patients. And the atrial fibrillation patients can continue near normal lifestyle on tablet treatment or catheter ablation or a combination of all the treatments.